As the 40s opened, the world was a mess. But by 1944, the United States had shown the world the power of our ideals and the capacity of our conviction as we led the drive to end World War II. In the swell of optimism that ensued, President Harry S. Truman pushed for national health insurance to cover all Americans. That was 1945. He didn't get his wish. Not on his watch.
The Beatles!
Close your eyes and I'll kiss you. Tomorrow I'll miss you.
20 years later, only half of the elderly had any sort of health insurance, and it was generally expensive, poor coverage. But in 1965, Lyndon B. Johnson signed into law our Medicare program to cover Americans over 65.
No longer will older Americans be denied the healing miracle of modern medicine. No longer will illness crush and destroy the savings they have so carefully put away over a lifetime, so they might enjoy dignity in their later years.
Harry Truman was the first enrollee, and within a week, 1 million Americans signed up. The 70s was a decade of change. Mood rings, lava lamps, Rubik's Cubes, and pet rocks all captured the imagination of Americans. Changes came for Medicare, too, with the first big expansion of the program. In 1972, coverage was extended to people under 65 if they were disabled or had end-stage kidney disease. But it was increasingly obvious that Medicare left a lot of costs to the beneficiary to cover. There were substantial deductibles and coinsurances for services. Insurance companies stepped in with Medicare supplements or Medigap plans to help cover the things that Medicare didn't, but for a monthly premium. By the 80s, winning solutions started to unfold, maybe where you least expected it. The miracle on ice was the Olympic medal-round men's ice hockey game in 1980. The U.S. team, made up of amateur and collegiate players, defeated the Soviets, who had won nearly every world championship and Olympic tournament since 1954. The U.S. went on to win the gold medal in hockey. Hard work and determination can yield big results, and Medicare was hard at work, testing ways to provide high-quality, more affordable coverage. They evaluated demonstration projects with private companies, contracting with them to administer Medicare benefits for beneficiaries. These Medicare plans had the potential to coordinate care for beneficiaries, reduce members' out-of-pocket costs, and provide extra benefits, like drug coverage. As the 90s rolled in, the Cold War died, the World Wide Web was born, and well-crafted sitcoms ruled primetime.
The doctor will be with you in a moment.
Elaine, you shouldn't be reading that.
I noticed that someone wrote in my chart that I was difficult in January of '92.
By 1997, Congress passed the Balanced Budget Act, which expanded the role of private plans under the new Medicare Plus Choice program, now called Medicare Advantage. That same year, a local company called People's Health Network launched a Medicare demonstration project in 3.5 parishes of the greater New Orleans area. That project grew into one of Louisiana's largest Medicare Advantage plans, People's Health Choices 65. We've been growing ever since. As we opened the door to the new millennium and fears about Y2K evaporated, anything was possible. Old technologies were being replaced by new, and new laws were extending new benefits to Medicare beneficiaries. Part D came out of the Medicare Prescription Drug Improvement and Modernization Act of 2003, and Part D went into effect in 2006. By 2010, politics were polarized in the U.S., but whether you agreed with it or not, the Patient Protection and Affordable Care Act of 2010 was passed. The legislation aimed to control costs while rewarding plans for improved outcomes for their members. With our robust health services department and our in-hospital plan representatives, People's Health found itself well situated to grow in the new regulatory environment. Nationally, more than 25% of all Medicare beneficiaries are in a Medicare Advantage plan, and approximately 1 out of 7 Americans is on Medicare. To offer some perspective on how our population will be changing in the very near future, experts say 10,000 baby boomers will turn 65 every day between now and 2030. You can help us improve the lives of people with Medicare. No matter what your position, you are key to our mission to provide high-quality health care to the members we serve.